We really want to have an open forum to give people an opportunity to talk about their ideas on healthcare reform, where we should be going, what we should concentrate on, even to the point of talking about legislation. There's several groups that are working in different areas on this kind of a plan, but we wanted to get them all together so that we would be talking not as representative of any particular group, but the field in general, including consumers, the workforce, employers, and so that we can get a broad perspective of what everybody thinks we should be doing, so that then we can move forward with a definitive plan.
And in those groups, we're going to be looking for what are those key questions that we need answered.
At the Issues 2014 Symposium recently held in Sacramento, the first steps in a coordinated effort to address upcoming healthcare reform were taken by industry leaders from throughout California. Moderated by Kathy Jett, former director of the State of California Department of Alcohol and Drug Programs, this symposium illuminated the concerns facing addiction professionals and treatment providers as they prepare for healthcare reform.
My goal for this meeting is simply to get everyone to be on the same page. I think as we're heading into healthcare reform, it's important that everyone who is seeking to serve the community of substance abusers be coordinated in the effort. That's ultimately what's going to be best for the workforce. That's ultimately going to be best for the citizens of California. And hopefully today, by the end of the day, people are going to agree on the same agenda. We'll agree on moving forward together, and we'll get the state on the path of serving this community as best we can.
Well, I'm hoping that we talk about how we fit into the healthcare reform, and that we're going to be ready when that comes out in a couple of years.
Well, I think today is a real opportunity for all the types of different professions that work in the industry of providing alcohol and drug services and other related behavioral health issues to come together today and really start taking a look at a California plan to support healthcare reform coming across our country and into the state of California. Today, I would like to see a new group of leaders emerge from this meeting that can continue on the work of integrating addiction treatment issues into the mainstream of mental health care.
I would like to see us both on the side of legislation as well as those of us who are down in the trenches keep our focus on the person and the families that are being devastated by drugs, alcohol, and addiction.
I would like to see organizations unified to try to get some definition of where we're going with healthcare reform and how it's going to affect our state.
Well, I'd like to see a discussion about how the future regulations can continue to keep an open door for faith-based recovery programs.
To develop a strategy to make sure that alcohol and drugs are at the table as we go through realignment or whatever happens with the budget, that our voice is heard loud and clear.
State leaders and industry experts in attendance were optimistic that this was a positive first step.
I think the most important thing to come out of a meeting like this today is to get a consistent message to Sacramento on the professionalism within our field. That we do work together, we can work together, and that together we're going to make addiction services stronger in the state of California.
We'd like to thank Symposium moderator Kathy Jett and recognize the significant participation of Thomas Powers, former Chief Deputy Director of the Department of Alcohol and Drug Programs, as well as Tom Renfrey with the County Alcohol and Drug Program Administrators Association of California. We wish to thank the primary sponsors and underwriters of the symposium: California Association of Addiction Recovery Resources, California Association of Alcoholism and Drug Abuse Counselors, and Breining Institute. And we encourage all California stakeholders in the addiction field to stay in touch, keep informed through one of the sponsoring organizations, and stay tuned.